Good afternoon, everybody, and thank you for taking your time out of your day to join us for this presentation called Starting the Medicare Conversation, where I'll present some talking points and sales concepts to help you initiate this important conversation with your clients. Before we begin, I will let you know that there is an opportunity to ask questions. So just to ask a question, just type it into the control panel there that you see on your GoToWebinar control panel in the chat feature, and I'll be sure to address and answer all questions at the conclusion of the presentation. Of the 10,000 baby boomers turning 65 every day in our country, a common statistic that we're all familiar with, many of these people may be your clients who have come to trust you for important insurance or financial matters. A 2017 study that Merrill Lynch conducted says that less than 15% of the people in this population have a trusted resource to help them understand, prepare for, or manage retirement health-related expenses. It went on to further say that 70% of married couples had not even discussed with their spouse healthcare costs in their retirement years. Many of these people are your clients who need to know that they can turn to you for their Medicare guidance and answers. It's important to educate your clients on the important costs of healthcare in retirement years. The Center for Medicare and Medicaid Services estimated in 2017 that the annual cost for people in good health is $7,620. But those who have serious health conditions like diabetes or heart conditions will pay even more at $12,000 per year. In Fidelity's annual study suggests that a 65-year-old couple retiring in 2018 will need an average of $280,000 over the course of their retirement to cover medical expenses. That's a 2% increase over the amount in 2017 and a staggering 75% increase since 2002 when Fidelity first conducted the study. In a lot of situations with your clients, you likely know their age. And in situations like that, you can ask simple questions to begin the important Medicare conversation, like, in regards to your health coverage, are you self-insured? Ask them, do you have a Medicare Supplement or a Medicare Advantage plan? If your client already has coverage, a simple statement like, if I may review your coverage, I could save you money and improve your benefits. In some situations, people are unsure of what route to take or unsure of their current coverage. And you could just simply say, I can help you choose the Medicare coverage that best meets your needs. In a lot of situations throughout one's insurance agent's career, the focus is on financial planning, where they're selling life insurance or maybe you're selling an annuity to help your clients preserve their wealth and savings for retirement. But it's important to incorporate health insurance costs into the overall financial picture and how you can help your clients save money on healthcare, the highest expense in retirement. When you don't tell your clients you can advise them on healthcare expenses, you risk losing all of their business to an advisor who's incorporating healthcare into the overall financial picture. When one turns 65 and they're on Medicare, it's important that you discuss the options with them that they have to help them pay for Medicare's out-of-pocket expenses. There's Medicare Supplement Plans and Medicare Advantage plans. When the conversations with your clients turns towards the specifics of coverage, it's really important to point out to them the out-of-pocket costs that original Medicare Parts A and B leave for the beneficiary to pay, and how a Medicare Supplement Plan can pay for those costs. Medicare Supplement Plans pay for these deductibles, these co-insurances or co-pays that Medicare leaves to the beneficiary. be sure to point out specifically like the $1,364 Part A deductible that one would have to pay out of their own pocket if they were ever admitted into a hospital stay, if they were just on original Medicare. If they didn't get a Medicare supplement plan, they'd have to pay that out of their own pocket. But the Medicare supplement plan would pay for that cost. And other Medicare coinsurances and copays, like the 20% Part B coinsurance. These costs alone justify the cost of any Medicare supplement plan. It's also important to note that Medicare supplement plans are affordable monthly premiums with no network restrictions, making them very popular plans for those who travel to warm weather states during these cold winter months. And those on a Medicare supplement plan will incur little to no out-of-pocket expenses, and the benefits are standardized. So the benefits with one carrier are the same benefits with any other carrier. In order for agents like yourselves to sell a Medicare supplement plan, you don't need any special certifications, just a simple health license, and to get appointed with the particular carrier that you intend to sell. You've likely heard that changes is coming to Medicare supplement plans in 2020, and carriers are making plans now to prepare for these changes. These changes are a result of the Medicare Access and CHIP Reauthorization Act of 2015 that stated that Medicare supplement plans like Plan C and Plan F will no longer be able to pay the Part B deductible beginning in 2020. However, I want to clear up any confusion or misconceptions out there that Plan F or Plan C, for that matter, they're not going away. They're just simply not going to be available to those who are Medicare, to those newly Medicare eligible as of January 1st, 2020. But anybody that was eligible for Medicare before January 1st, 2020 will continue to be able to purchase Plan C and Plan F, regardless of their current coverage. Please be sure to ask us if any questions and stay tuned to us for all the developments regarding these changes in the coming months ahead. Medicare Advantage plans combine the Part A and Part B benefits and must cover at least what Medicare covers. They include HMO plans or PPO plans, private fee-for-service plans, special needs plans. And most Medicare Advantage plans include prescription drug coverage, but some do not. They require the policyholders to pay the Part A and Part B premiums, but cost zero to little premium per month in exchange for higher out-of-pocket costs, like deductibles, copays, and coinsurances when you go to meet your medical providers. These out-of-pocket costs can be capped anywhere from $2,900 to $6,700 per year, depending on the carrier and the area in which you live. Medicare Advantage plans can also cover benefits that are not part of original Medicare, so they're very benefit-rich plans. And also be sure to note that if you want to sell a Medicare Advantage plan, you certainly need to be certified with that particular carrier to sell that plan and also to earn your renewals in the renewal years. Part D is your prescription drug portion of coverage of Medicare. Prescription drug plans, they're offered by private insurance carriers, and the drugs are classified into specific tiers, with each tier has a corresponding copay. Medicare prescription drug plans can be either standalone plans or combined with a Medicare Advantage plan, and they follow certain specific enrollment guidelines similar to Medicare Advantage. Now that we've discussed some of the basics of Medicare and Medicare supplements, I want to go over some strategies to help you advise your clients about their healthcare costs in retirement years and how you can become that trusted advisor. It's important to build upon the trust that you have already established with your clients. Studies that I've mentioned in this presentation are just suggesting that seniors really are clamoring for guidance on their Medicare choices. So be sure that you're the one that's offering this guidance on the best options for your clients. When you've already gained your client's trust, it's important that you then remain assertive and convey that you are the expert when it comes to Medicare. And by being the expert, it's important that you just understand some of the basics of Medicare and when you can enroll your clients and some of the out-of-pocket costs that we've discussed and how a Medicare supplement or an Advantage plan can help reduce those out-of-pocket expenses. In a recent conversation I had with an agent explained to me that he lost a sale because his client wanted a Plan F, and he indicated that the client went with the Plan F because that's what the client wanted. But that the agent then also knew, though, that the Plan G, Medicare Supplement Plan G, would have been more affordable option for his client. This particular agent, even conveyed to me that he knew all about the upcoming changes to Medicare and that the Plan G was looking more and more a favorable option. But in the situation where this agent only dabbled in Medicare, sold a little bit of Medicare Supplement Plans, he wasn't assertive. He didn't convey that to his client that he was the expert or steer the sale towards the plan that best met his client's needs. After a brief conversation with this agent I had, realized that he let a sale slip away because he didn't take control. So I just reiterate that story just to convey the message that when clients are coming to you, be sure to direct them towards the plan that's going to save them the most money, and be assertive in your presentations. And when you don't know a specific question or an answer to one of your client's questions, be sure to just give us a call at Art Jetter & Company. I'll be sure to answer any of your remaining questions. It's also important to make sure that you are marketing to people of all ages and that you're not just focusing on the people who are turning 65 and selling Medicare plans. The 40-year-old client who trusts you for all of your life insurance or P&C coverage that you're offering them will certainly want to refer you to his parents or loved ones for their Medicare guidance. Selling Medicare plans offers tremendous value to your client relationships. It's important that you don't just sell just one policy, because if you sell just one policy to your client, you risk losing them to someone who can offer a more comprehensive portfolio. Property and casualty carriers and their agents have really mastered the bundle concept. They sell home, auto, boat insurance, and even life insurance to their clients. Why not Medicare too? When you incorporate the bundle concept, you become a one-stop shop for your clients' insurance coverage. With each additional policy that you sell to your clients, you dramatically increase your client's persistency, which puts more money in your pocket, and more importantly, it strengthens the relationships that you have with your clients. Part of the Medicare conversation is being sure that you're asking the right questions. For example, how do you pay for dental care? Or could you use some extra cash to cover a hospital stay? What happens if you get cancer? Or are you insured in the event that you would be confined to a facility? These are common needs amongst many seniors, and a senior dental policy, a cancer coverage, or a hospital indemnity plan can provide these needed benefits. Just asking these simple questions can strengthen the relationship you have with your clients and help you make more money. When you don't ask these questions, you risk losing sales and leaving money on the table. And each time you don't ask those questions, or when you do ask the questions, it can lead to a sale 50% of the time. Here you'll see an illustration that demonstrates the amount of money that can be made, for this example with Medicare Supplement Plans. You'll see the compound effect of offering and selling MediSups to your clients. They offer level commissions for 6 years. In this particular example, we demonstrate that what one can make earning a 20% commission. Through the compound effect, you earn your commission each year for your new business sales. Then beginning in year 2, you earn your new business commission plus your renewal commission on existing business. So this example of just Medicare supplement sales with a $1,500 premium at 20% commission, after 6 years, an agent is earning more than $90,000 for just MedSup. Now, if you go on and add a dental or another ancillary product, producers are earning more than $100,000 on just senior health business alone. Now that you got your clients listening and they're ready to purchase a plan from you, it's important to seal the deal. And to do this, it's really important that you focus on brand recognition with the carrier that you're selling them, that financial strength of that carrier, or the superior customer service that that particular carrier provides. It's really recommended to ensure a smooth business transaction with your clients by submitting the applications electronically. Applications that are submitted electronically are issued within minutes, and many carriers offer a temporary insurance ID card that can be emailed to the applicants as soon as the policy is issued. Certain carriers that offer a full portfolio of senior health products make it really simple to even add additional products to the MedSup sale with just a simple click of the mouse when you're using the electronic enrollment process. The Medicare conversation is not a difficult conversation to start. Just knowing the basics of when to enroll, the options that are available, and what is covered is extremely valuable. And again, when you don't know the answer or you have some questions, just give us a call, and anybody on the senior health team will be glad to help you out and answer your questions. We make it even easier for you here at Art Jetter & Company to really be the senior insurance advisor. We have one of the industry's premier quoting tools available that can help you quote Medicare Supplement, Medicare Advantage plans, hospital indemnity plans, final expense, dental, vision, and hearing, all on one platform. That's available to any of our appointed producers. We have a great customized leads program where when you get appointed with any of our carriers, we'll immediately give you a list of 100 people who are Medicare eligible, either turning 65 or any other Medicare eligible age. We have free E&O coverage as well for our producers that will cover you on any business that you write through our company. But I want to thank everybody for attending the presentation this afternoon. It seems like all the questions have been addressed. And if I could be of any assistance, or anybody in my team here can be of any assistance, please feel free to contact us here at seniorhealth@jetter.com or call us at 800-228-0008. Again, thank you everybody for attending this presentation, and we appreciate your business. Thank you.